It is beneficial because we update all their past medical history, we update their past surgeries, we offer advanced directives. If they don't have that information, that would be like living will, power of attorney information. We do screenings if there's anything that the patient needs at home, like maybe a walker, a wheelchair. We screen to see if there's something that we can do to help. We also verify with the pharmacies that the medicines that they tell us that they're taking are the medicines that are actually in our medication list, so we have the right dose, the right frequency. If they were to get ill, come to see the doctor or go to the emergency room, hopefully that medication list would be accurate, so no mistakes would be made. Especially this time of year, we offer the flu vaccine. Medicare pays for that, and pneumonia vaccines. We make sure that if they haven't had the pneumonia vaccines, that we also offer that to patients. There's certain criteria for other screenings. Maybe if they're a baby boomer, they haven't been checked for hepatitis C, bone densities for ladies, AAA's screenings for gentlemen, cholesterol for any patient if they meet the criteria. And when they're finished with their visit, they have an accurate, up-to-date medication list, surgical list, and medical problems list that they can use for future references if they need it. Medicare pays for this visit. Medicare is trying to have people come to the doctor before they're ill. They're trying to make sure that if there is a problem that they can detect something sooner than after you're ill and you have to be in the hospital. You're sick longer. If they detect it before it's a problem, then you stay healthier longer. The questions that we ask, the screenings that we do on the Medicare Wellness Visit are nothing like what the typical ill visit is to the provider. We have different screens that we go through, and we try to see if there is something that we could do to make their life better at home. Do you have any transportation issues? Are you getting enough food? Can you pay for your medicines? Do you have a smoke detector? There's just different things in the Medicare Wellness Visit that are not anywhere near what the ill visit would be to a provider. If someone has a specific problem at home, maybe they don't have a rides providers, we would call Faith in Action. We would do mass transit. We would see if someone could get them rides to the provider. If they needed home health and met the criteria, we could call and see if we could set that up. If they need exercise classes, if their balance is off, we could call the senior care. We could call Chester Sutton. We could have physical therapy. We could even have visiting nurses come and do therapy at their home. If they needed a walker or wheelchair, physical therapy could do an assessment to see what would help them the most with devices. If they needed a ramp, we would call someone. If they needed the food pantry, what their need would depend on what services we called to help them. So as you heard, the Medicare Wellness Visit is a little bit of time, but it has a lot of rewards. Call us. We'll be glad to schedule your Medicare Wellness Visit.